Given the public health priorities today in India and globally, especially in developing countries, uh, I think that some key interventions have to be made. The first and the most important, in my view, is to strengthen the public health care system. And that means system strengthening, all the way from the primary healthcare center up to the tertiary level. This is critically important because no matter what services are delivered by government, they have to be delivered through the public health system. So if the public health system itself is not able to, for any reason, is unable to deliver those services, we are not going to go far. The Ebola epidemic is an example. Today we know that in West Africa, the reason why it's gone out of control, this epidemic, which is now becoming a pandemic horror, is because the public health system in those countries where it began and where it flourishes is unable to handle the problem because of the fragility of the public healthcare system. This is a living example we are facing right this minute. Now in India, God forbid if this should happen, I do not believe that the public healthcare system is going to be able to handle this issue. And one fears to think of what can happen. Now Ebola happens to be a communicable disease. And India is facing a number of communicable disease problems that it has far from solved. So they clearly have to be addressed, and they have to be addressed through the public health system, primarily. And I'll go to the private sector a little later. But we are also faced with the double burden of non-communicable diseases. And today, unfortunately, we can't wait. We could have said a few years ago that let's get the communicable diseases out of the way first, and then we'll deal with these other problems. But today, these are epidemics in and of themselves. Diabetes, hypertension, cardiovascular diseases, and so on. So we can't wait. So we need a robust system of healthcare delivery. Now, if we're dealing with the poor, which is my major concern, then it has to be the public healthcare system. But over the years, we've also recognized that despite there being, for many, many decades, supposedly a public healthcare system in place, it has really not been able to deal with the issues with any degree of quality or even coverage. And so the private sector has come into play quite elaborately now, quite significantly today. Whether it's rural areas or urban areas, it's the case. So let's recognize that the private sector also has a role. And we're talking of public-private partnerships which need to be encouraged. But at the same time, even though we know that 70% or more of the people, even the poor, are going to the private sector for healthcare delivery, we also know that this sector is totally unregulated. And there are huge issues, ethical issues in particular, cost issues and so on, which are interrelated. So we can't anymore ignore the private sector. We will also have to address the issues that the private health sector is facing, so that it can be really brought in partnership with the public sector. And then of course we have the civil society, which is a very strong force in this country and increasingly so. It's not the major actor in being able to deliver all services, but it has a role to play, a very important role to play in terms of innovation, in terms of showing the way, in terms of experimentation, in terms of developing models that can be pursued, upscaled, etc. So I think that's another sector that we need to pay attention to. So it has to be a joint effort, actually, of the public sector, the private sector, the civil society, and all the other actors that are involved. And of course, we also know that health requires the health sector, but it also requires other sectors beyond the health sector. So we need to therefore take a multidimensional approach if we are going to do this.